Normally a raised rash with thick silvery scales, we call it. And the color of the rash is normally pinkish in color, and it is a very well demarcated kind of rash. And where will be the distribution of the rash? Commonly, it will be at the elbows, knees, and also patient can have a rash on the scalps. It's also commonly associated with nail involvement and also joint involvement, whereby patient can present with swollen, red, painful joints. So from young till the very old, we can get psoriasis at any age. But there are two peaks where we can get psoriasis. The first peak is the range of 20s, and the next peak will be about 50s. That means the immune system just had some problem with the immune system, and they recognize our own skin as an enemy, and they will start creating antibodies to attack your own skin. And as a result, there will be an increase in cell turnover of the skin. Therefore, patients have a thick rash with the scales. We know definitely psoriasis, there's some genetic component in it, right? And besides that, environmental factors. But up to now, we still don't know what kind of environment will actually cause psoriasis. Yeah. So, genetic, what are the chances of a person getting it? Like, as I mentioned, my dad has psoriasis, so I have about 20% chance of getting psoriasis. But if my mom has it as well, then my risk will go up to 60%. We have 5 types of psoriasis. The commonest will be what we call chronic plaque psoriasis. This is the typical psoriasis where you get a raised, scaly rash, salmon pink in color with a well-demarcated margin. Then we have the flexural psoriasis, where the psoriasis can happen at the flexures, meaning folds. We are the folds, groin, axilla. Then we have the pustular psoriasis, where the patient can have tiny little pus on the rash. Yeah. And number 4, we have what we call guttate psoriasis. Guttate means teardrop. So the psoriasis rash is actually like a tears, like very tiny little psoriasis. Can be throughout the whole body. And it is not common. It's more common among kids, among children, after a sore throat infection. Number 5 will be what we call erythrodermic psoriasis. Erythrodermic means involvement of the rash of more than 90%. So in this case, the patient had extensive plaque psoriasis. There's pneumonic, we call TIMES. T is for trauma, meaning if a patient injured himself, example had a cut on his skin, psoriasis can happen at the site of trauma. I is for infection. If a patient has a sore throat, the patient can have a flare of psoriasis. M is for medication. So medication such as antihypertensive medication, medication that we use to treat for tuberculosis, all this medication can trigger psoriasis. E is for endocrine, hormones, hyperthyroid, hypothyroid diseases, even menses is there's hormonal change. S is for stress. I divide stress into 2, psychological stress, physical stress. Psychological stress such as exams, physical stress such as if they're tired, lack of sleep, long distance traveling, all this can trigger psoriasis as well. S also stands for smoke, so cut down or if possible stop smoking. S also stands for spirit, spirit meaning alcohol, so try not to take alcohol. So psoriasis is the clinical diagnosis, meaning by looking at it, you're able to diagnose the disease. We may need to do other investigations. For example, skin scraping, and then look under the microscope. Then we are able to differentiate between psoriasis and fungal infection. Very rarely also, we will need to rule out other skin diseases such as skin cancer. For mild psoriasis, we will treat with topical treatments. For example, vitamin D creams, topical steroids, and also tar preparation. But moisturizing bath gel as well as moisturizer, they are very important in the treatment of psoriasis. One of the mainstay of treatment is still moisturizer. Followed by that, for sometimes moderate to severe cases of psoriasis, then we will use phototherapy, either narrowband UVB or excimer light. For severe patients, we will consider systemic treatment. So we will discuss about option of either oral treatment or injection. Oral treatment such as cyclosporine, methotrexate, acitretin. These are oral treatment, but we need to monitor closely all these patients because potentially there can be side effects. So biologics are actually antibody that actually blocks. They are protein antibodies that actually blocks the problematic pathways of the immune system that cause psoriasis. But nowadays, because the antibody is so specific that they block only a particular pathway that affects psoriasis, so it's very safe medication to be used nowadays. Especially nowadays with the advancement in treatment, patient can definitely have a clear skin. I'll tell them there's no problem with this because nowadays the medication is so good that I can even promise them within 4 weeks, we can clear the skin, psoriatic skin. First of all is to be compliant, meaning if you're on topical treatment, make sure you continue to apply the topical treatment. If you're on systemic agents, either oral treatment or injection, remember to continue to administer those treatments. And come back for follow-up because there are certain medications which we need to monitor the blood, and also there may be changes that we need to adjust accordingly. For example, a patient who is very well, just a few rash, in a few months' time there may be more rash that we need to change the treatment. And avoid triggers. How do we define severity of psoriasis? Is a patient having a mild psoriasis or a severe psoriasis? So besides looking at the surface area, the involvement of the rash, let's say a patient with 90% of the body surface area involvement, we know this is severe psoriasis, versus a patient with just 1 or 2% of the body surface area involvement. But we also know that severity depends on how the rash affects the quality of life of the patient. How do we define quality of life? For example, a patient, let's say she's an air stewardess or a supermodel. If just one little patch on her face, it will affect her quality of life. It will even affect her job. She'll be grounded, right? Versus an uncle that is retired and he has only have 2 friends and you hang around in the coffee shop for the whole day, every day. For him, even though there's involvement of the whole body, the rash involves the whole body, for him, it doesn't affect his quality of life. Of course, also physically, if there's involvement of joints, it's straight away considered severe. Recurrent arthritis will lead to deformity, and that's something very, very severe because we cannot reverse the deformity. So in Malaysia, according to our registry, it is about 12,000 patients diagnosed to have psoriasis, but it is underreported, because that registry only captures the public from the public hospitals. But we know among the private practice, we do see quite a number of psoriatic patients, and roughly the prevalence in Malaysia will be about 2%, same as worldwide. Psoriasis is definitely not contagious because we know that it's not an infection, although infection can trigger the psoriasis, but psoriasis itself is definitely not contagious. Up to now, we still haven't found a cure to it. But I always tell my patient, this is the era of psoriasis, where we can control the disease really well. We can clear the disease, yeah? But it is to control the disease and not to cure.